Welcome back. You're still watching Shape Your Life, the show that aims to teach you everything you need to know about health-related matters. Dr. Duvern Ramia took time off his busy schedule to give us some insights on breast cancer and how we can play our role in fighting the battle against this deadly disease. Doctor, thank you so much for joining us on Shape Your Life.
Well, it's an absolute pleasure. Thank you for having me.
How would you define breast cancer?
So any cancer is, something has gone wrong with the cells. So something has gone wrong with the genes within there, and the cells start dividing uncontrollably. And these cells don't die. And then what they do is that they can start damaging the tissue that they're within. So breast cancer is when this happens within the breast. So it starts damaging the breast tissue, and as it does this, it can get into the lymphatic drainage system, or it can get into the blood vessels, and then from there it can be transported to other parts of the body and damage those organs or bones that it gets into. And that's pretty much breast cancer. It's a cancer that starts in the breast.
What are the signs and symptoms regarding identifying and being aware as an individual with regards to breast cancer?
So a lot of the patients that we see these days actually don't have any symptoms. A lot of them are picked up with screening mammograms. So generally women over the age of 40 are encouraged to have a mammogram every year, even if they don't have any signs and symptoms. So, a lot of them are picked up that way, and it's good if it is picked up that way because often it's early, and when breast cancers are picked up early, you have a lot more treatment options. So women should do breast self-examinations every month in order to pick it up. Some of the other things are people feel a lump under their breast, or sometimes, if it's more advanced stages, can feel things like bone pain and that sort of thing. But generally the most common is a lump in the breast.
Doctor, we know that cancer doesn't discriminate on age. So are there any particular ages that women should be a little bit more aware regarding lumps in their breast or going for their breast examinations?
Well, generally it's encouraged for women to, over the age of 40, to start going for mammograms. If there's a very strong family history, or if they know they've got a genetic predisposition to getting breast cancer, or if they've had previous disease, some sort of benign disease in the breast, sometimes those women might want to start earlier, and they might even want to do things like an MRI scan of the breast instead of the mammograms. So yeah, basically over 40.
Can men also be affected by breast cancer?
Absolutely. About 1% of breast cancers are diagnosed in men. So it is something that men should be aware of. And if men feel a lump, they should also have it looked at. They shouldn't think that, this is something that only happens to women.
When it comes to treatment, I know there's amazing advances with regards to treatment options for cancers in general. Are there any specific ones for breast cancer?
Well, some of the new things that we are doing are genetics testing on the breast cancers themselves, so we can home in on exactly what type of chemotherapies would be useful in that type of breast cancer. And in that way, the chemotherapies, or sometimes the more targeted treatments, are becoming, having less side effects and are becoming more effective. So, that's one of the treatment options on the table, is chemotherapy. The other thing that is generally used for breast cancer is surgery, and that would entail usually surgery to the breast and surgery to the glands under the armpit. The types of surgery generally are either a lumpectomy, which is just take out the tumor in the breast, or you can have a mastectomy, which is the whole breast comes out. And that, which one depends on women's preference, depends on the size of the tumor, the size of the breast, and also women do have usually a long chat with the plastic surgeon about reconstructions afterwards and what would work out best in terms of reconstruction.
Are there any particular ways or lifestyle adaptations we could do to prevent the risk of breast cancer?
Well, the main sort of risk factor for breast cancer, they say, is a lifetime exposure to estrogen. And what you can do to prevent that is women who generally have babies earlier in life have a lower risk of developing breast cancer. Women that breastfeed also, and women that don't take hormone replacement tablets or oral contraceptive pills also have a lower chance of developing breast cancer. And then, also being obese, can also is a risk factor. So, generally keeping within a healthy weight range is also beneficial.
Doctor, thank you so much for your insight, your input, and for sharing these wonderful pearls of wisdom with us.
No, it's an absolute pleasure. Thank you for having me.
We spent time at the Breast Health Foundation to learn more about what they do to help promote breast cancer awareness. thank you so much for joining us on Shape Your Life.
Thank you for having us on the show.
Please tell me more about your organization.
Okay, the Breast Health Foundation started in 2002. Its mission and vision in a nutshell is education, awareness, support and navigation of patients. So we are actively involved from an education point of view at grassroots level, clinics, corporates. We would speak to anybody anywhere about breast and how to do breast exams. We do navigation of patients, so if we chat to somebody and they have a problem, we can refer them into either a public sector clinic like the one at Helen Joseph or into a private clinic if they have medical aid.
What are some of those myths that you still have to debunk up to today?
Oh, there's plenty. Microwaves cause breast cancer. Microwaves do not cause breast cancer. Money in your bra cannot cause breast cancer. Breast cancer is a cell in your body that becomes a little terrorist, changes its form and shape and becomes a cancer. Money in your bra cannot turn that cell into a terrorist. Things like, particularly in South Africa, the tokolosh has been sucking on your breast or you've been bewitched. A lot of these myths are still out there and it's not true. Okay. Unfortunately, with breast cancer in particular, it can happen to anybody. It doesn't discriminate. It doesn't look at your age. It doesn't look at your bank account. And we do have men diagnosed with breast cancer as well.
Now, when we're looking at it, you mentioned that the support team for the clinic here are breast cancer survivors. And are some of them still dealing with treatment? And if so, their passion for being through the journey and educating people, does it extend beyond just the education, or rather the experience when coming to a government facility and to soften that for you to feel cared for?
Firstly, the work we do, I always say to my team, the day you don't feel like coming to work is the day you stop. Okay? It's a labour of love. You need to be passionate about this. And it is extremely difficult when you meet a patient and you go through a journey with them of 2, 5, 10 years. And then maybe something happens to them and they die. So there's a lot of emotional investment from the team to work with patients. They become family. They become buddies for life. It's not a patient that you see once and they're gone. There are patients here that come back, treatment 9 months average, from your chemo, your surgeries, possibly radiation, and then every year, 6 months to a year, you come back for your mammograms, you come back for your checkups annually. So this is a long-term journey. It's not something that see you today and I'll never see you again.
But that is probably so important when dealing with the people living with breast cancer right now, because it's draining with all the treatment they have to go through, the wait, the procedures, and the emotional distress that they're under too.
That too. We've got a support group called Buddies for Life. We meet every 6 weeks average. We get speakers coming in, whether it's doctors or physiotherapists or any number of topics that the buddies are interested in. And when you walk in that room, it's like a big happy family that's getting together and they haven't seen each other for ages. Because you all have a commonality. You all have had breast cancer, been through treatment, you have similar challenges. Once the hair grows back, it doesn't mean it's over after treatment, because then it's a long-term process. And I think the women find strength amongst each other because they're in an environment where the person next to them has been through something similar and understands the challenges. And I think that's the most important part of the breast cancer journey, is the doctors are there, they have medicine available, they've got the latest technology available, but it's the support structure of cradling that person through their treatment.
That's the buddy system.
It's the buddy system.
Which works.
Yes.
When you mentioned earlier the awareness, especially at grassroots level, about self-examination, because surely that will be the indicator to go and see your medical specialist. Are young ladies receptive to literally following the right procedure and examining their breast to see if there's any lumps?
When I was in my 30s and I found my lump, I knew nothing. Zip, zero, oh, there's a lump in my breast. And I went on holiday. I didn't think about it. I didn't have that education as a youngster from my parents or from the doctor, because breast cancer doesn't affect younger women. Well, unfortunately it does. So when you start speaking to the youth, it's like wearing a safety belt. We get taught from being young, Get in the car, put on your safety belt. Why? Not because you're going to be in an accident, but if it happens, you've got something to protect you. And if we teach the youth, young girls, early teens, students on how to do clinical or self-breast examinations, they're aware as they get older. We find it's the older generation, the 40s and 50s and 60-year-olds, that find the lumps and go and do nothing about it. And by the time they come into a clinic like this unit, they have quite an advanced large tumor. It can still be treated. The idea at the end of the day about education is, if we educate the youth, in 10, 15, 20 years' time, we will have women presenting with smaller cancers and being diagnosed earlier than what we're having now.
What is your final piece of advice to the viewers out there when it comes to breast health and breast cancer?
Don't be scared of your boobies. Check them, feel them, get to know them. If you're not sure, ask your partner to check them, feel them, and get to know them. 9 out of 10 lumps are not a cancer, but rather have it checked. See a doctor, see a clinician, and rather be safe than sorry.
Oh, thank you so much for your time and for the passion that you bring into what you do. It's infectious. And with the pink walls, we have to come back and visit.
Everything's pink. Great. Thank you very much for having us on the show.
In our next insert, we chat to a woman who was diagnosed with stage 4 breast cancer, had to have a mastectomy and go for a draining period of chemotherapy and radiation treatment. But she won the fight against cancer and is now helping others do the same. Mom Jay, thank you so much for joining me on Shape Your Life. When were you diagnosed with breast cancer?
In 2013.
Wow.
It was February 2013.
And what happened? What led to you finding out that, okay, I now have breast cancer?
It was after I just had a bath and just putting a lotion on my body. And I discovered there was something here. And I was attending an orthopedic clinic. Then I decided to tell my doctor that there's something that I don't understand on my breast. And they referred me to the breast clinic.
And then what happened?
Then when I went there, the doctor checked me, and she said, it was a female doctor who checked me, and she said to me, no, you need to go for mammogram. They've sent me for urgent mammogram and urgent FNA. Then I went to do those
screens and those tests?
Yes,
yeah.
Those tests. I went to do those tests. After 2 weeks, the test came back. I had breast cancer.
Wow.
And guess what? It was on stage 4.
Stage 4. And how did you feel when they gave you the news?
I didn't know what was it, you know. Oh. At first I was like, dumb. I didn't know. But as the doctor explained to me what was it, and I was so scared. The first thing that came to my mind is I was going to die. I was very scared.
That's the worst feeling and thought that one could have.
Yes.
Then what did you do when you got home?
Well, you know, what surprises me is immediately when I got my results, they filled in a bed letter for me. They admitted me immediately.
Oh, okay.
Immediately. Then I've asked for pass out because it was on a Friday. I asked for pass out so that I could go home and prepare for my kids. I'll come back on Monday. And the doctor said, no, you need to come back Sunday. At least by lunchtime, you must be here. I didn't tell my husband because I didn't know what to say. I didn't tell anybody. I cried the whole night. I couldn't sleep because I thought if I sleep, I won't wake up. And I just told him I'm going to hospital. They're going to admit me. I didn't tell him for what.
Sure.
I only told him when I come back. But before you go for operation and everything, they counsel you. You get a counseling.
Did that help you?
It does help. It does help a lot. Because at first I didn't know, I didn't have anyone to speak to. So the counseling did help me to at least speak about it, you know. And as you talk about it, you heal a bit, you know.
It's true, they say, that if something's on your heart or your brain, you know, if you keep it in, it becomes like a sore that gets worse and worse.
Sure.
But when you talk, it's like medicine for the soul. And then what happened? So once you had the counseling, and that really helped you, because I'm sure it helped you gather strength as well.
It helped me a lot. Very helped me. It helped me a lot. And because when they told me that they're going to do full mastectomy, and they've explained what is it, I was like, okay, it's fine.
Were you okay with that?
I became okay because I've been for counseling already,
makes
you know,
sense. So you
because I've
understood
been
why.
for counseling. And when the doctor was surprised and said, can you live without a breast? I said, doctor, if that means I'm going to survive, I'm going to live for my children, it's fine.
Amen to that. Amen. So then you went for a mastectomy.
I went for mastectomy.
And then?
After that, I went for my chemo. I did chemo. I complete my chemo, then I went for radiation. And in between still you get counseling.
So the support is important.
The support is very much important.
And that's where you get it from, the foundation, you know, and so forth.
I joined the foundation because I thought this can help me to help other patients, you know. This is the way of me giving back to other people. Because now they taught me how to accept this. You know, the first thing that you need to do is to accept that I've got this sickness and I'm going to take treatment and I'm going to recover. You must be positive at all time. You need
That must
to
be
be
so
positive.
difficult. I mean, I totally value and appreciate the counselor's passion because they go above and beyond the call of duty.
True.
But when you eventually told your husband and your family,
Yes, that was after after I've been with the counselors. Then I got the strength to tell my husband.
wow,
When I came back from surgery, then I said to him, you know why I was in hospital? He said, I don't know. Then I showed him. I said,
and
because
what
of
did he
this.
say?
He was so scared. He didn't want to look. He even cried. I said, don't cry. I'm okay. I had breast cancer, but now that they've removed it, I'm okay. I'm going to survive.
They say the strength of a woman can never be underestimated.
Now I was counseling him.
You were counseling him, so you were literally walked into your own home NGO.
I even told my children, I've got 2 kids, 16 and 8. I told them, I said, Mommy's got breast cancer, but Mommy's not going to die. Mommy will take treatment and she'll be fine.
And that's all the kids need to know, that Mummy will still be there. What is your advice to our viewers out there that might, you know, be concerned for a family member or even themselves that have gone through breast cancer, that have seen it through, but, you know, it might have recurred? What would your advice be to inspire them to just be positive?
I'd say to them, firstly, they need to speak up. We need to talk. Don't just keep quiet, close the problem within you. You see, you need to talk about it. If there's anything that you don't understand on your body, speak about it with your doctor, or find someone in your family, close person that you trust, and speak to them.
And find the foundation.
And found the
because
foundation, and you go for counseling. You go to the counselors and speak to them. If you're taking treatment at the hospital, speak to the counselors.
And that is why I say you are so inspirational, because, you know, you and the rest of the team here speak from a point of reference and a point of walk that journey already and still walking it, because it, you know, it doesn't just stop suddenly.
No,
so I wish you the best in what you've done. You know, your smile radiates the room, and just keep radiating the lives of people out there that you positively impact.
Thank you very much.
To all the women out there, young and old, you need to do regular self-breast screening. And if you do find a lump, please go to your doctor as soon as possible. And don't forget that you can keep in touch with us by sending an email to shapeyourlife@ann7.com with all your health-related queries or topics that you would like seeing being discussed on this show. From me, Ronald Abaji, and the Shape Your Life team, see you next week.